the Friday Five here on the Agent Survival Guide podcast. I'm your host, Sarah Ruppel, and this is our weekly list of 5 things you should know about. Today is Friday, June 12th. This week was Apple's Worldwide Developers Conference, the annual event we watch to learn more about what will be coming to Apple software. Normally, I come away from watching the presentation with a couple of features I'm excited about. This year feels a little bit different, and I think that's because so much of the focus of the presentation was on AI features that we were promised 2 years ago that never materialized. It should feel like all of those AI announcements are big news, but given what happened last time around, I think a lot of us are feeling either skeptical or underwhelmed. And then on the design front, we just went through the big liquid glass overhaul in iOS 26. So we're not really getting many changes on that front, just small tweaks and opacity controls. One feature I was excited to hear more about, though, updates to parental controls. I have 2 questions here. One, will the new updates make screen time and parental controls worth using? And then the second, will it Sherlock tracking apps like Bark or Life 360? I have my hesitations, and that is as a parent who has tried many times to make screen time and parental controls work for our family. And the only thing I've consistently been able to do is require approval for app downloads to go through me. Anything she wants through the App Store goes through an approval process. But even that, oddly enough, those requests only go to my iPad. They do not come through my phone, even though both devices have the same Apple account. And that is just one pain point to contend with. Another is that my daughter has been able to reset the screen time password so many times or figure it out and disable it. So that has not been effective. My phone is also sometimes able to be unlocked via Face ID when it is my daughter's face. That is something that's not supposed to be able to happen, but it does indeed happen from time to time. And then I would say overall, parental controls on Apple, they're not really complicated, but I don't think they're as streamlined as they could be. They could work better. They could be simpler. So if this update does that and the features they were talking about actually work, I am sure I'm not the only one who would appreciate it. But let's talk about what's coming to these safety features for kids. Setup will supposedly be simpler and will allow a few different app recommendation sets, ranging from predetermined app sets recommended by age, or parents can curate a selection, allowing for either bare bones essentials up to customizing it based on your kiddo's interests. Communication safety features were already in place for users under the age of 18 and would blur nudity. Now that will also include a filter to block gore or violence in videos or images shared with your child. Time allowances and daily schedules are included in the press release, and I will say that if Apple has found a way to simplify these settings so that changing them doesn't break everything I've set up like it currently likes to do in Bark, that could be a game changer. I often say no to changing schedules and downtime because it often either does not work as intended or it breaks the other rules, which is frustrating. I am tech savvy. It should not be this difficult to monitor another device. Like I said, I am excited about these features, but I'm in the cautiously optimistic camp of excited because a lot of these features currently exist on Apple devices. They just don't work well, or I've had to seek out more robust offerings from third-party apps. I will be keeping an eye on this one, looking forward to testing it out when the new operating systems become available in the fall. Moving on to our next story, and sticking with tech updates for a minute here, on my favorite social media platform, Instagram. This feature was announced some time ago, but it's now rolling out to users. The ability to control your grid layout beyond just the ability to pin posts. The update has made it to my phone, and I've played around with the feature a little bit, mainly moving a few images around that I've recently posted. Repositioning an image is as simple as long pressing on the image to pull up a menu where you can select Reorder Grid. You'll be taken to a new screen that shows your grid view and lets you drag and drop your images in the order you would like. If you have images that are pinned, you won't be able to move anything into those spots until you've unpinned those images. Just something to be aware of with that. I'm not sure that the functionality is built for moving an old image into, say, your top 15 images, depending on how long you've had the account. But if you were posting something in a very specific order and you mixed up two posts, it's a little bit easier to fix that mistake with this new feature. Continuing on with our tech updates this week, let's talk about what's new with IntegrityCONNECT. If you are new to the show, our podcast is powered by Ritter Insurance Marketing, a national field marketing organization in the industry. And Ritter is an Integrity partner. So when agents register with us and have a conversation with your local rep, we can get you access to all of the Integrity platform tools, in addition to the resources we offer here at Ritter. Last week, Integrity held Integrity Innovate, where they talked about a bunch of features that are coming soon to IntegrityCONNECT, and one that has just launched. So let's start with what is new, and this is very exciting for agents who sell different products. Annuities are now available within IntegrityCONNECT, specifically the fixed indexed annuity product and multi-year guaranteed annuity products. That makes IntegrityCONNECT the place where agents can quote health, life, and now annuities. And it's not just quoting. Annuities are also on your agent personalized website. And when it comes to taking those applications, don't forget that the CRM data pre-fills most quotes and apps with just one password and login. Work smarter, not harder is something that we say quite often at home in my house, and there is a reason for that. It is a philosophy that runs through both Ritter Insurance Marketing and Integrity, and we continually ask ourselves, how can we streamline the business side of our agents' lives so you can help your clients, but also have time for your family and your community? Having as many tools as possible in one place is a great starting point, and this is a great time of year to make the switch. In addition to helping you write business more effectively, IntegrityCONNECT has features to help with all the pre-enrollment season work of figuring out which clients you need to see most urgently, the ability to automate your outreach and stay organized. Even better, we've got training webinars for just about every stage and feature of IntegrityCONNECT. So we will meet you where you're at and help you get to where you want to go. And I haven't even talked about the AI capabilities offered through Ask Integrity. I mentioned that we have some new features in the works, some of which are powered by new AI capabilities. First up, smart documents that you can upload one time and let our AI do the work of organizing those files, pulling key details in as well as tagging your clients. Next up, the Notification Center, where you can see missed calls, texts, emails, even important client actions that you should be taking. This feature will help you to stay organized and help with prioritizing tasks. Something that can be tough to know when you're first starting out, or in those moments where it feels like everything is on fire. I know I cannot be the only one that's had moments when I am the cartoon with the coffee cup, or I'm the one inside the dumpster on fire floating down a river. And then the final standout feature, renewal reviews that let agents compare current plan options with future plan options, so you can help your clients see their choices clearly, side by side, and hopefully make a more informed coverage choice, whether that ends up being staying in the same plan or switching to a new one because of a particular benefit that maybe was missing in their current plan. We will be linking to our events calendar in the episode notes. Most of the webinars on Integrity Connect have the name right there in the title of the webinar or description. Depending on the time of the month that you hit the page, you might want to use Control F or Command F to search through those webinars specifically. We have a lot of trainings available. And fun fact, for Ritter agents contracted and participating in your best AEP yet, this year, step 1 is actually to attend a webinar about Integrity Connect. And there are some pretty sweet rewards associated with completing each of those steps. Another place to find a webinar. If you already have an Integrity Connect login, you can find a list of webinars by clicking on the Learning section and scroll down through the list of webinars. There are full-length tech webinars, Tech Tip Tuesdays, even on-demand versions of select webinars in case you miss the call. We will have the links to both of those resources in the episode notes. Highly recommend jumping into one of those webinars and learning about what Integrity Connect can offer you this enrollment season. Certification season has not quite started, but that is just around the corner. The time to update your plan presentations and materials is here. And one of our favorite resources, KFF, just published their annual report on Medicare Advantage enrollment updates and key trends. I have said it before, but I will say it again. I love the way that KFF sets these reports up. First of all, they are consistent in their reporting, so we often get historical data in addition to the most current plan year information. Love that. The tables and graphs are laid out in a way that make the stats super easy to understand. And they allow their tables and graphs to be downloaded and added to other presentations. And bonus, these are timely, compliant resources. Also love that. Let's get into the numbers for coverage year 2026. 55% of eligible Medicare beneficiaries are currently enrolled in a Medicare Advantage plan for the 2026 coverage year. According to KFF, the numbers come out to 35 million beneficiaries in Medicare Advantage plans from the overall 64 million beneficiaries enrolled in Part A and Part B of Medicare. That number is up from 54% of that same demographic last year. So we're still seeing growth. It's just not as much growth as, say, between 2022 and 2023, when MA enrollment increased from 48 to 51%. The rate of growth between 2025 and 2026 was about a 3% increase, adding 1.1 million beneficiaries to the Medicare Advantage side of coverage. When we zoom in to look at the Medicare Advantage plan enrollment breakdown, there are 3 groups we divide that enrollment into. 1, employer or union-sponsored group plans. 2, special needs plans. And then 3, individual plans or general Medicare Advantage enrollment. 16% of MA enrollment is in employer and union-sponsored group plans. That is down from 17% in 2025. 23% of MA enrollment is in special needs plans, up from 21% in 2025. And then individual plan enrollment makes up 61% of the overall MA enrollment, down from 62% in 2025. Just like last year, the majority of growth in Medicare Advantage occurred in special needs plans. We mentioned that 23% of the Medicare Advantage population is enrolled in a special needs plan. Looking at the numbers, that's close to 8.2 million Medicare beneficiaries, up about 900,000 from last year's numbers. And then zooming in a little bit closer at that special needs plan segment of 8.2 million beneficiaries, 124,000 Medicare beneficiaries are enrolled in institutional special needs plans, or I-SNPs. Not too much of a change from 2025 numbers when we had close to 115,000 Medicare beneficiaries in an I-SNP. Still accounts for about a 2% share of the overall SNP population. Looking at the C-SNP, or Chronic or Disabling Conditions Special Needs Plan next. For coverage year 2026, 1.7 million beneficiaries are in a C-SNP plan, up from 1.2 million in coverage year 2025. Share of enrollment increased here between 2025 and 2026. 16% of all SNP enrollment was in C-SNPs in 2025. For 2026, that percentage increased to 20% of the overall SNP population. And then for dual-eligible special needs plan enrollment, 6.4 million MA beneficiaries are in D-SNP plans, also up from 2025 when just 6 million MA beneficiaries were enrolled in that plan type. Here, even though enrollment numbers are up slightly from 2025 to 2026, the share of beneficiaries in D-SNP plans actually decreased. In 2025, 83% of the SNP population was enrolled in a D-SNP plan, whereas in 2026, 78% of the SNP population is enrolled in a dual-eligible special needs plan. These are not the only stats highlighted in this KFF report. So if you would like to read the full version, and we highly recommend that, grab some of the tables and graphs for your own presentations. We will have the link in our episode notes, so be sure to check that out. And moving on to our top story this week, let's talk about the new Medicaid work requirements. There's a little bit to unpack here, and I think it's probably good to start off with a little bit of context. We try our best to talk about some of the reasoning behind legislation on this show. One of the things we often end up talking about is the interpretation of the law, which can vary depending on who is reading the law and how they define certain terms. Back in June 2024, the Supreme Court struck down the Chevron deference on the basis of how they interpreted the role of an administrative agency, specifically when the law was written ambiguously. And then more recently, we've had carriers bring lawsuits to CMS over star ratings, citing similar and different reasoning to different and similar effect. Now, we are taking a look at Medicaid work requirements, which were initially outlined in the 2025 Budget Reconciliation Bill, with program design due by June 1st. So let's talk about what was included in the interim final rule, because to be honest, this rule did not quite turn out how a lot of people had originally thought it would. First, we have a new definition of medical frailty and new exemption criteria. We also have new methods of verification and administrative enforcement that are important to talk about, as well as timeframes. I think that's probably the factor I've seen the most discourse around, the amount of changes and the fact that implementation is expected on most of these items by January 1, 2027. In order to enroll in Medicaid or continue to be enrolled in Medicaid, certain adults must meet a work requirement. Not all, because as we said, there are still quite a few exceptions. But according to the CMS description of work requirements in their recently published fact sheet on the interim final rule, quote, the work requirements pertain to applicable individuals or non-pregnant adults between the ages of 19 and 64 who are not entitled to or enrolled in Medicare and are eligible for or enrolled in the Medicaid adult group or in certain Section 1115 demonstrations that provide minimum essential coverage to adult beneficiaries, end quote. Applicable individuals, as CMS is referring to them, must either work or complete community service or participate in a work program for at least 80 hours per month. For those who are enrolled in school, enrollment in the educational program must be considered at least half-time. Individuals can combine work, community service, and participation in a work program to get to the 80-hour mark per month. And then as far as income goes, applicable individuals' monthly income can't be less than the federal minimum wage multiplied by 80 hours. And for reference here, the federal minimum wage rate is $7.25 per hour. According to the CMS fact sheet, some adults meet these requirements because they are under the age of 19. They've enrolled in another Medicaid eligibility group, or they were previously an inmate or were previously exempt. So that's what we're looking at for work requirements. Already defined some exemptions there, but let's get into more exemptions. Individuals exempt from Medicaid work requirements include former foster care youth, American Indians, Alaska Natives, parents, guardians, caretaker relatives, or family caregivers of a dependent child 13 years of age and under, or a disabled individual, veterans with a total disability rating, individuals who are medically frail or otherwise have special medical needs that significantly impair their ability to comply with the requirement. Individuals who meet the temporary assistance for needy families work requirements or are a member of a household receiving SNAP benefits and aren't exempt from the SNAP work requirements. Participants in a drug or alcohol rehabilitation or treatment program. Inmates of a public institution, and as we mentioned earlier, those who are pregnant or eligible for postpartum coverage in their state. That is the list of exemptions, but the one we want to talk about is the exemption for those who are, quote, medically frail or otherwise have special medical needs that significantly impair their ability to comply with the requirement, end quote. From the original outlining of the Medicaid work requirements in the budget reconciliation bill to this version of the interim final rule, CMS added, quote, significantly impair, end quote, to the definition, setting it apart from their own definition of medical frailty for alternate benefit plans. And there is a whole section in the final rule explaining why they did that. So that is part of what has people talking about this legislation. Additionally, CMS added verification requirements that would require states to verify an individual's Medicaid enrollment with data. So, for example, insurance claims data that would verify their medical frailty and inability to work. Per CMS, self-attestation of medical frailty would be allowed for those with a January 1, 2027 coverage date, whether they are renewing or enrolling for the first time. It would also be okay for mid-year renewals. But in 2028, Medicaid enrollees will only have the ability to self-attest one time. And during the course of 2027, CMS is encouraging states to verify information Medicaid enrollees are sending in and continuing to check their rolls for verification of medical frailty. So while at a federal level, someone might be able to self-attest and remain enrolled, if their state is conducting more frequent verification reviews, they might have to produce documentation of their medical frailty. And then the third layer of all of this is that for state Medicaid agencies, they have 18 months to figure out how they are going to verify documentation so that when the more lenient self-attestation period ends, they have their technology up and running and are able to streamline this whole process. Some critics claim that this additional verification and enforcement beyond what was passed in the Budget Reconciliation Bill of 2025 is going to put a strain on state Medicaid agencies. We will have the links to all of the information CMS has put out on the new Medicaid work requirements, and there are quite a few different write-ups they've done in addition to the rule in the Federal Register. We will be keeping an eye on these requirements, and should anything change, we will report back here in a future Friday 5 episode. So if you're not already following along with the show, you can do that in the app you're listening on right now. And then when we publish future Friday 5 episodes, you'll get those sent directly to your listening queue. A lot of information this week. So much good stuff in the notes. And as always, I hope you have a great weekend. Stay healthy and stay safe out there. And we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an Integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Emily Ryan. Podcast design by Urban Rivera. Like what you hear? Follow along with our show wherever you get your podcasts.